So guys, you're welcome. It's me Oscar once again. This is Suckspirit Medical Academy, and in today's lecture we shall be talking about joints, where we shall look at definition, classification, and clinical correlates. So by definition, joints are just places of union between two or more bones. Where two or more bones articulate is called joints. So these are points at which bones articulate in a simple way. Classification of joints. Joints are basically classified on the basis of their structural features, and we have three classifications under which all the other types of joints fall. We have fibrous joints, also called synarthrosis. We have cartilaginous joints, and we have synovial joints, also called diarthrodial joints. So all other types of joint, at least under one of these. Starting with fibrous joints. Fibrous joints are joined by a fibrous connective tissue. They have no joint cavities. They permit very little movement. Examples of fibrous joints are sutures in the skull. That's an example of fibrous joint. Another type of fibrous joint is syndesmosis, and here two bones are connected by a bundle of ligament or a sheath of ligament. They basically provide stability and allow very little movement. It can be found in between the inferior part of the tibia and fibula, forming a tibio-fibular joint or tibio-fibular syndesmosis. Another classification of joints is cartilaginous joints, and here we have joints being united by cartilage, and they have no joint cavity. They are basically divided into primary cartilaginous joints and secondary cartilaginous joints. Primary cartilaginous joints are also called synchondroses. They are united by hyaline cartilage. They permit no movement, but they allow growth in length. They include joint between the manubrium and the sternum, forming the manubriosternal synchondrosis. Secondary cartilaginous joints are also called symphysis, and they are joined by fibrocartilages. We have primary cartilaginous joints are joined by what? Hyaline cartilage, whereas secondary cartilaginous joints have fibrocartilages. If you want to know the difference between the two, you can go and watch our lectures on cartilages, where we talked about the different types and classification of cartilages. So secondary cartilaginous joints include the pubic symphysis and the intervertebral discs. So this is where these joints are what can be found. The third classification of joints is the synovial joints or the diarthrodial joints. For them, they permit a great degree of movement, and they are classified according to the shape of the articulating surface or the type of movement that is permitted by the joint. And the synovial joints have basically four characteristic features, which include: one, having a joint cavity, 2, having articular cartilage. And the articular cartilage here found in synovial joints is the hyaline type. They also have synovial membrane, and this synovial membrane produces synovial fluid. In the synovial fluid, we have nutrients for the nourishment of the cartilage. It offers lubrication at the joint surfaces. Another characteristic feature of this joint is that they have a titular capsule. So examples of diarthrodial joints include plane joints or gliding joints. Here we have two flat articulating surfaces that glide over each other to form this joint. We can see an example of how it appears here, and we find this kind of joint at the sternoclavicular and also at acromioclavicular joints, among other sites in the body. Hinge joints, also called ginglymas joints, they resemble the hinge of the door and allow only flexion and extension. They occur in the elbow angle and also as the interphalangeal joints. Pivot joints, as an example of synovial joints, are also called trochoid joints, and they are formed by a central bony pivot turning within a bony ring, and they allow only rotation, that is movement around a single longitudinal or central axis. So this is like an illustration of it. We can see here they only allow rotational movement in a single central axis. They facilitate rotation rather than other types of movements. They can be found as the inferior radioulnar joint and superior radioulnar joint. We can also find them at the atlantoaxial joint. Condylar joints or ellipsoidal joints have two convex condyles articulating with two concave condyles. The shape of the articulation is ellipsoidal in nature, thus the name ellipsoidal joint. They allow flexion and extension and occur in the wrist joint. So we can see here we have these two bones here, that is the scaphoid and the lunate, forming the convex condyles, and then the radius ulnar, and then these other couple joints forming the concave condyles, illustrated also here. The saddle or sheller joints resemble the shadow on the horse's back. Okay, they allow extension and flexion, abduction and adduction, and the circumduction. They don't allow actual rotation. They can be found also at the carpometacarpal joint of the thumb and between the femur and the patella. So this is where we can find actually this joint. Ball and socket joint, also called spheroidal or cotyloid joint, are formed by reception of a globular ball-like head into a cup-shaped cavity, and they allow movement in many directions. They allow flexion, they allow extension, abduction and adduction, medial rotation, lateral rotations, and also circumduction, and they can occur at the shoulder joint and hip joints. So we have a long bone with a ball-like head inserting itself into a cup-shaped cavity to form a ball and a socket joint. Clinically or clinical correlates, we have osteoarthritis, which is a non-inflammatory degenerative joint disease characterized by degeneration of articular cartilage and osseous outgrowth at the margins. It results from wear and tear of joints. It commonly affects the hands, the fingers, hips, knees, feet, and spine. Rheumatoid arthritis is inflammatory disease, primarily of joints, and it is autoimmune disease in which the immune system attacks the synovial membranes and articular structures, leading to deformities and disabilities. So rheumatoid arthritis is autoimmune and it is inflammatory. There is no cure for rheumatoid arthritis, but we have drugs we can give to relieve pain, swelling, and stiffness. Gout is just a painful form of arthritis, and it is caused when there's too much accumulation of uric acid in the blood. Uric acid crystals get deposited in and around the joints, causing an inflammation and pain, heat, redness, stiffness, tenderness, and swellings of these joints. This has been today's lecture about joints. Please like, share, subscribe, comment in the comment sections, and see you in the next video. Let's spread the love. God bless.